you all to our very first ever event of its kind, Impact Guru Excellence in Healthcare Summit and Awards. Our summit is focused to drive more meaningful conversations on making healthcare accessible and affordable to all. We have a power packed list of knowledgeable sessions lined up, and we are hoping all the discussions are of tremendous learnings and value to all of you. Agenda sessions at the summit feature leaders from the healthcare fraternity speaking on varied themes from treatment and financing of rare diseases, future of cancer care and finance in India, future of transplant innovation and infrastructure, digital transformation in hospitals, and new models and strategy for healthcare financing and investments aligned with their knowledge and expertise. We will wrap up our virtual event with Impact Guru Excellence in Healthcare Awards, where we will be celebrating the achievements of leaders and organizations that have made commendable contributions to the healthcare ecosystem in India. To start off, we are extremely pleased to share that our chairperson for the event is our co-founder and CEO of ImpactGuru.com, Piyush Jain. Piyush currently leads a team of over 500 at ImpactGuru.com. We are India's leading integrated healthcare financing platform. ImpactGuru.com is funded by leading healthcare and fintech investors and has scaled tremendously by impacting thousands of patient lives and families in India. A background about ImpactGuru's co-founder Piyush. He was previously a M&A investment banker with JP Morgan. Piyush has an undergraduate degree from Wharton Business School and a graduate degree in public policy from Harvard University. Piyush was featured in the Fortune 40 under 40 list in India and was felicitated with the Social Entrepreneur of the Year award by Entrepreneur India magazine. Piyush was part of the 2020 cohort of Stanford Seed Transformation Program, as well as part of the 2020 cohort of the Global Good Fund Fellowship Program. Just recently, Piyush was amongst the elite winners of BW Healthcare 40 under 40 list. Over to you, Piyush.
Thank you, Sandeep, for that warm introduction and a warm welcome to everybody here who's attending this fabulous event. So let me get started. We are today hosting Impact Guru's Excellence in Healthcare Summit and Awards 2022. And it's very, very timely. Before I begin and talk more about the event and what healthcare financing is all about, just a very brief overview about our company. Impact Guru is a healthcare financing platform that focuses on helping patients fund their out-of-pocket medical expenses. Since our inception in 2015, we've now helped mobilize over 2,000 crores along with our other crowdfunding partners, helped over 20,000 patients and raise this money from over 2 million donors. We've been very lucky to get a lot of recognition along this journey from various institutions, both domestically and internationally. And what we are really happy about is that India's leading hospitals from private sector and public sector, they have all collaborated with Impact Guru on our mission to help save the lives of over 1 million patients in the next decade. The reason why Impact Guru was started was because of a very unique problem in India where medical expenses is leading over 50 million people into poverty every single year. And this number has only increased during COVID. So let's talk about scale of India's healthcare and India's healthcare financing opportunity. Every minute, 110 people get hospitalized. Every minute, 43 health insurance policies get issued. Every minute, 27 claims are paid on health insurance. And every minute, over 26 lakh rupees worth of funds are required by patients to fund their hospitalization, whether from friends, family, savings, or lending institutions. The reason why healthcare financing is a multi-billion-dollar opportunity in India is because there's a missing middle class. If we take a detailed deep dive into India's overall health insurance, what we realize is if we segment our population into three income strata, poor population, a lower middle and upper middle class, what we see is that 70%, over 500 million Indian people have zero health insurance. And those who do have health insurance typically get it from their companies or through the ESIC scheme. And many of these customers do not have more than 5 lakh rupees of sum assured, which is woefully inadequate in today's post-COVID India. What makes this health insurance penetration worse is the fact that out-of-pocket expenses in India is 61%. That means for every 100 rupees of healthcare expenditure, 61 is financed by the patient themselves, which is very, very high if we contrast this to China at 34% and the United States at 11%. So if we take a look at the saving situation in India, what we realize is that the per capita income is about 1.5 lakh rupees. And according to the data by the Reserve Bank of India, the net financial savings is actually less than 7% of GDP. And even if you were to concentrate 90% of India's wealth to 10% of the entire population, you still get only a per capita savings of about $1,400, which is very inadequate compared to the high costs of critical illnesses, which are only increasing every single year due to very high medical inflation. That's why we at Impact Guru believe that our middle class population is only one hospital bill away from poverty. And this is something we want to radically change and disrupt through a very strong and comprehensive integrated healthcare financing approach at Impact Guru. And if we take a look and estimate how large the healthcare financing opportunity, we believe that healthcare financing is an $18 billion year opportunity in India, and we estimate the target addressable market at $4 billion. If we specifically look at inpatient hospital bills, we estimate at Impact Group that about 60% of them are funded by out-of-pocket and about 20% through insurance and another 20% through various governments. So today, a big part of the focus for discussion is rare diseases. Globally, there are over 300 million people who are suffering from a rare disease. And unfortunately, the vast majority of them, about 80%, are genetic in terms of origin. And children are some of the biggest victims of rare diseases. And many new rare diseases are being reported regularly, and there are very few alternative therapies are out there to treat the patients suffering from these diseases. In fact, according to the National Policy for Treatment of Rare Diseases and various research reports that have been published by the Indian government, about 95% of rare diseases have no approved treatment. And in India, it's a very, very large number of people who suffer from this, with an estimate of about 70 to 100 million people who are facing these rare diseases. And we want to change this together as a platform, along with the help of the larger public in India. Impact Guru has already demonstrated the true power of crowdfunding, through which we have raised over 16 crore rupees to save the lives of 4 young children who've all gone on to receive the gene replacement therapies called Zog and SMA. It is one of many different therapies that are available to treat spinal muscular atrophy, which is a rare disease. But on the Impact Guru platform, you've had patients who have raised money for various other diseases, including DMD, a different kind of muscular atrophy, including cyrinomylia, which is the mermaid syndrome. We believe that due to the vast amount of generosity that exists on the internet, Indian public can crowdfund for and save the lives of any patient in India who's suffering from a rare disease. And today, I'm very pleased to announce that Impact Guru is launching a research report publishing some of the detailed statistics and work that we have done, where we've witnessed over 12 lakh donors who have contributed over 125 crore rupees, about $17 million just in the last 14 months on our platform. Today, Impact Guru is currently hosting 1,200 plus patients who are raising money for different diseases. And the amount of generosity at offer is really mind-boggling. At peak velocity during COVID, our platform even witnessed 1 donation per second for a very long period of time. New age digital payment methods such as Paytm, Google Pay, and UPI are, of course, very, very popular. And we see a high amount of generosity from the age group of 25 to 45 on our platform. So thank you very much, everybody, for joining in. And we look forward to having an engaged discussion throughout the entire day, which will be concluded by an awards function. Thank you once again.